We've had a great afternoon at the COSTEM meeting discussing the optimal preparative regimen for patients with acute myeloid leukemia in first CR. Quite a lot of time has been spent discussing fairly abundant retrospective data, which broadly suggested equivalence. And then Bart Scott presented the only two large randomized trials. The first by the German group using an 8-gray TBI backbone as their RIC regimen. Some might say that's quite a punchy RIC. Compared with 12-gray myeloablative regimen showed broad equivalence. And then the US CTN study, which compared essentially myeloablative doses of busulfan with lower doses of busulfan, showed a benefit for the myeloablative arm in terms of disease-free survival. A study that the US CTN should be applauded for delivering, but it's quite a tricky one to interpret because the relapse risk in the RIC arm is much higher than we would have anticipated from previous studies, and the myeloablative relapse risk was accordingly somewhat lower. But nonetheless, Bart was bringing out the important point that MRD may be an important discriminator in terms of which regimen one may choose to use in patients in whom you have a bit of a dilemma. Clearly, if patients are over 55 or 60, you're going to opt for a RIC. But there was clear evidence that in the MRD positive patients in this study that there was a benefit from myeloablative regimen. So maybe that sways you a little in this intermediate age range to opt for a myeloablative regimen. But what's clearly needed is further randomized studies of this important question, regimen specific, using embedded prospective MRD. The MRD that was used in the CTN study was not conventional flow MRD, but was an NGS-based strategy, and also genomics. So we're in a position, I think, where if you're fit and you're under 55, we would use a myeloablative regimen if we can. And we're beginning to understand a little bit more about which patients should get a MAC over that age. But most centers, I think, still would use a RIC in that setting, unless a patient was really fit.